So I think I've sent all of them.
Okay. You shall please take note of the Mentimeter codes.
With this orange Q1 and Q2. Menti.
Hi,
Yeah,
Joe.
I think
Hi, Gifty. All dressed
Hi, Joe.
up. Look at you
Hi,
with the
Joe.
luminous red.
Hi, Joe.
Hi, Uche. How you doing?
I'm doing just fine, as
Yes,
much as can be
Uche,
expected.
I think you should send the Mentimeter code to Joe as well.
Okay.
So they can help us put it in the chat box whilst people join us.
Sure.
All right.
Happy to do that.
Thank you.
Thanks.
And Uche, is your surname pronounced Ogwaluonye?
You kind of have to go up. Ogwalonye. You have to go up.
Ogwalonye.
Yes.
Second tone.
Wow.
Yeah.
You sound very, very Nigerian, Joe.
Yeah.
That's
You actually got it.
No.
But this is more like the
Hardly.
shortened. This is kind of like the shortened version of the name. So yeah.
How long is your name?
Yeah. Let's not go into that. Let's worry about the presentation for today.
Okay.
All right. So we have about
And
2 minutes.
Uche, what title should I use for you? Should I call you a CHI fellow or something else?
Well, I am a CHI fellow. So I think I just I like going by just my first name. So Uche is just fine.
Okay. And you're a pharmacist by training, right?
Yes, I am.
D Farm.
No, that's B Farm. B Farm.
Oh, B Farm.
So
B
if you,
Farm. But you're a
yes, so
pharmacist.
yes. Well, there is a provision for a conversion, but that takes like 2 years.
I think since we already have 73 people in the waiting room, as soon as it hits the hour, I'm going to go ahead and launch in, introduce you guys.
Okay.
All right, thank you.
Welcome. I'm Joe Tucker from UNC Chapel Hill, and I am delighted to be with you here today at our CHI Social Innovation Training Workshop Series. We have a great presentation today from 2 of our CHI fellows. Dr. Gifty Marley is a postdoctoral fellow at UNC Project China. She's based in Guangzhou, and she is joined by Uche Ogwalonye, who's a pharmacist in Nigeria. And today they're going to be telling us about monitoring and evaluation of social innovation, which is really a key topic. So as per our typical training series MO, please mute yourself. Please do introduce yourselves in the chat box and take advantage of the Mentimeter participation opportunities. So without further ado, over to you, Dr. Gifty and Dr. Uche.
All right, thank you very much, Joe. Good morning, good afternoon, good evening, everyone, and welcome to our presentation on monitoring and evaluation as it applies to social innovation. We do hope that by the end of this presentation that you would actually, have taken the first step, in understanding how the importance of monitoring and evaluation, and how it relates to social innovation, how it also improves social innovation outcomes. So as initially stated, my name is Uche, and with me here I also have Gifty. And today we would focus on just a brief recap on social innovation. And before we head into just discussing a bit about monitoring and evaluation, then we'd follow that up with a brief discussion about some case studies that relate to monitoring and evaluation, that apply monitoring and evaluation in its use. Then we'll have a panel session, and then we'll finish that up with an interactive session. So a brief recap, social innovation. Now, social innovation basically is a concept that encompasses all solutions, that involve a sort of like multi-sectoral approach to dealing with health challenges. Now, the difference is that it actually involves, a sort of like multi-sectoral approach where you have members of the community, you have the government, you have all the different persons actually working together in order to achieve a particular health outcome. And the good thing about it is that it's actually a bottom-up approach as opposed to what we have typically, where you have sort of like a top-to-bottom way of implementing health innovations. Now, basically, social innovation, there are differences between social innovation and other sorts of innovation. And the major difference is the fact that it is usually tailored to a particular context. In other words, if a particular innovation is actually maybe started at maybe a particular location, let's say, for example, in Nigeria, or if in order to implement that same innovation in a different place, you might have to make some differences that actually implement or actually incorporate certain contextual differences. So for example, if a place, let's say, is predominantly Christian, and you want to maybe implement in somewhere like predominantly Muslim, in order to do that, you might need to make certain modification and corrections or certain changes in order to be able to do that. And that is one of the benefits of social innovation because it is fluid. And you also have to consider the fact that in order to be able to consistently hit your intended or your preset health outcomes, you need to, at each point in time, actually take a look, sort of take a bird's eye view and see, okay, what am I doing right and what am I doing wrong? And that is where monitoring and evaluation of social innovation comes in. It sounds technical, but I think it's something that we do on a daily basis. Think of what happens at the beginning of every year. You sit back and think about, okay, what have I done right this year? What have I even done wrong this year? How do I improve on it? Now, that is basically what monitoring and evaluation of social innovation has to do with. Personally, I like to think of monitoring and evaluation as sort of like cooking, for example, where in order to prepare a particular meal, you need to know what you're heading to. You need to know what you're preparing, and then you have to start from the beginning to actually test the food and be sure that different spices and all those things are put there in sufficient quantity. And that is one of the benefits of monitoring and evaluation. Now, on this point, I'm going to hand over to Gifty to actually take us through some of the basics of monitoring and evaluation. Thank you.
Thank you very much, Uche, and thank you for making monitoring evaluation sound so simple. Because I know my time, whenever I hear the word monitoring evaluation, I just freak out and start looking for my calculators and my Google Maps and all that because I expect it to be that technical. But as you said, yes, monitoring and evaluation are basically just systems that you put in place that help you keep track of what you are implementing. It helps you make sure that you don't deter from your goal, and it also helps you to assess the impact of what you are implementing. So I'm sure some of you will be wondering, why do we need to monitor social innovation when it is a new thing that no one has already done before? And actually, it's because it's a new thing that no one has ever done before. That's why we actually need to monitor it. And that's why we need to evaluate its impact to be able to say or to be able to propose or recommend it to the world. You need to be able to prove its efficiency as well as its effectiveness. So some of the importance of monitoring and evaluation to social innovation is the fact that it helps us understand what works in the field and what doesn't work. As we said, because social innovation uses a bottom-to-top approach, it means you're taking the ideas from the community, modifying it and making it more suitable for implementation. But that does not guarantee that it's automatically going to work. And hence, having these systems in place will help you keep track of where you are, what you have implemented, and whether what you're implementing is working or not. Another important reason for monitoring social innovation is the fact that there are currently no standardized guidelines and frameworks for most social innovations, because come on, they are new, they are now coming up, they are now emerging. And to help future people or others build up and be able to adapt what you are implementing, it is best if we can contribute to the existing literature, the existing frameworks that could inform future social innovation as well. And another thing that you want to consider is it helps you to assess the efficiency and the potential for sustainability of your social innovation. It helps you to keep track of your financial expenditure and how it is impacting, or actually how it's able to reach the various targets that you have set for yourself. So based on those few things that you have heard so far, my question to ask now is, how do we think social innovation, like monitoring and evaluation in social innovation, differs from monitoring and evaluating standardized or other forms of innovation, innovations? And you can put your comments in the chat box, and I would take a look at them, and we'll see what ideas you have for us. How do you think monitoring and evaluating social innovation differs from other forms of monitoring and evaluation? You can go ahead and put your comments in the chat box, and then I would take a look at that. Okay, so whilst we are waiting for the comments to come in, I think one of the things that we have to note is that social innovation does not focus much on the numbers, and rather more focuses on evaluating the whole process that is adopted in implementing the innovation itself. Now, this is a typical or a standardized, validated M&E framework, which has been adapted for implementation of various projects, not necessarily social innovation. And if you look at what I have filled out here, you would realize that if you're comparing this typical M&E framework to other M&E frameworks, those frameworks would usually have a lot of numbers. You have a lot of percentages and figures, because most interventions always evaluate the outcome in terms of number of people tested, or number of condoms distributed, or number of materials that have been distributed, number of participants present. However, with social innovation, it's more about the community participatory process itself. So you're looking at the type of activities that have been implemented, who was engaged in those activities, and then you evaluate the outcomes from those activities. The good thing about M&E frameworks is that they are basically there to help you define your project goals, and also define your indicators and keep track of what you are doing. So if you look at this M&E framework, for example, we have the first part, which is the goals, which usually just look at the goals of your social innovation, and then what outcomes you are expecting from the projects you are implementing to be able to say that you have reached your goal. So I filled this out using our current social innovative project we are implementing here in Guangzhou, which is the Pioneer Project. The Pioneer Project is a paid-forward strategy that aims or seeks to be able to scale up chlamydia and gonorrhea testing among MSMs in Guangzhou. And later on, I think we have a technical expert who is going to give us a little more detail on that project. However, in the meantime, most of the data that I have in here just talks about what the goals of the Pioneer Project are, what baseline materials already exist, because if you're going to evaluate, you need to have a baseline to compare your outcome to. What targets we hope to achieve or reach, where we hope to collect our data, and setting all those things in place actually help you when you're implementing, because it actually outlines the steps that you're supposed to follow in your implementation. I know based on all this, people will be wondering where they can get such an M&E framework, and whether there is a standardized or a specific M&E framework that you're supposed to use for monitoring and evaluating social innovation. As I said earlier on, most of these social innovations are now emerging, they are new, and hence there may not be some specified tools for specific type of social innovation. However, there are open resource materials that have been developed. I think one of the ones that I would really recommend is that you visit the WHO website to look at their M&E toolkit. There's also one developed by with the help of USAID, and that is strictly or specifically for evaluating and monitoring community participatory processes. Those are also some templates that are also freely available from the websites that we have included in our PPT. And you would realize from the additional emails that Yusha sent that we have also included some editable templates of M&E frameworks that you can adapt. You can have simplified ones as simple as maybe a Gantt chart or an implementation plan at your level. Or if it's a very big project that you're implementing at maybe a provincial or a national level, then you would maybe go for more detailed M&E frameworks like the logic modules. And most of these have already been done and they have been validated, and all you need to do is adapt them to suit what you are currently implementing. That means you have to change what the definitions of some of the outcomes and the goals are going to be to fall in line with your social innovation. In addition to some of the tools that I have mentioned, I have also included some links that you can visit to learn more about social innovation M&E frameworks and how to, let's say, adapt your own version for your specific project. And I also have here a paper that I want to recommend because CHI actually has been one of the pioneers of social innovation, and hence to help new implementers or upcoming researchers like us to at least have an idea what to consider when we are choosing M&E frameworks or when we are developing M&E frameworks. CHI Fellowship have actually developed a specific one for social innovation that I think would be very helpful and very useful for new beginners. And you can actually go through this in addition to the open resource materials from the USAID, from the WHO, and from some universities also offer free, should I call them tutorial videos on how to do monitoring and evaluation of community participatory projects. So the first question I want to ask about social innovation, from all that we have heard about its importance and how beneficial it is to have an M&E framework, my question is, at what stages of social innovation do we think it's important to apply an M&E framework? Please feel free to put your responses in the chat box. When do you think we should put or apply an M&E framework to our social innovation? Well, I'm waiting for some comment. I'm sure some of you have some interesting ideas that I'll be glad to read out. But one of the things I want to just basically list or mention is that as a social innovation, or as a new concept, right from the onset, right from the time in your room where you think about the problem in the community and say, hey, I need to investigate the cause of this problem, it is best to start thinking of how am I going to assess this problem that I'm going to identify? How do I hope to monitor whatever solutions that I come up with? And that means that right from the identifying the problem, coming up with a solution, implementing the solution, trying to scale up the solution and actually evaluating the impact of your project, you have to apply your M&E at all the steps. You can't single out one, because the third thing about social innovation is it keeps evolving as the project goes on, okay? When you identify where the problems are, then you can fix it to actually harness the or optimize the outcome. But if you skip out on monitoring and evaluating what you are doing, you are likely to miss out important gaps that you may have caused that will actually affect the outcome of your social innovation. So from onset, it's important to make sure that you evaluate your social innovation. And this this framework here mentions the 7 pillars that form most social innovations and the need to pay key attention to monitoring them. Now, the second thing we want to look at, or I know some of you are wondering, is who should be responsible for monitoring and evaluating our social innovation, considering the fact that there are a lot of stakeholders involved, and considering the fact that some projects are really small and you don't have a lot of people on the project, it's good to assign monitoring and evaluation to one person within the project team. And in addition to that, I always recommend that it's good to have an external person also provide some kind of oversight when it comes to monitoring and evaluation. This is because most of the time when you do something yourself, you are likely to be affected by what we call the IKEA effect. And what is the IKEA effect? It's the feeling or the phenomenon where when you do something yourself, you are less likely to see or to notice if it is not going well. And we all do that. Come on, if I'm to buy a bed from IKEA and I fix it myself, I don't care if it's making noise. I just feel proud of myself that I'm a carpenter and I've been able to put together a bed. However, someone else coming in, sitting on that bed and hearing it quick can tell me, girl, you need to fix that bed. And those are some of the important reasons to have a third person or an outside person take a look at what you're implementing and be able to give you some feedback on how to go about it. Now, the last question on this slide that I would want us all to think about and to put something in the chat box is, does monitoring and evaluation differ from quality assessment? And this one I'm not going to answer yet. I want to know what you guys think. Yes, Kwabena, that's very true. Having stakeholders from the community and also focal persons contribute to giving you oversight on your project's social innovation, help you give a better monitoring from a third eye view. Great. Yes, the community itself can also be a good source of monitoring and evaluation system for your implementation. Thank you very much, Jenna. Okay, so in terms of quality assessment, is that different from monitoring and evaluation? What do you guys think? Exactly. Monitoring and evaluation actually is an umbrella under which quality assessment falls. And yes, during last, Tima is also right, because although quality assessment is under monitoring and evaluation, it needs its own attention, because if you overlap them, sometimes you miss some important things that you need to pay attention to. And usually a lot of institutions prefer to have your quality assessment team stand alone from the monitoring and evaluation team. And it helps you get a better overview, not just of what you're implementing in terms of the deliverables, but also the quality of what you are delivering. So technically, quality assessment is under monitoring and evaluation as a bigger umbrella. So yeah, that's for this one. For those of us who are already eager to move on and start our own monitoring and evaluation, and we are asking what strategies do we use in monitoring and evaluation, because we keep saying it's good to have a framework, it's good to monitor and evaluate. How exactly do we go about it? What exactly can we do? And I think this is where the surprising thing comes in, because some of us don't know that we already have experience with the tools and the systems for monitoring and evaluating our social innovation. And drum roll, please, and ta-da! Those are some of the household or very basic means of evaluating and monitoring our social innovation. We have multiple aspects of social innovation, which means that there are different levels in the implementation, including the community participatory aspect, the actual outputs, which would probably be more of a quantitative aspect. Then you have the procedural assessment as well, which more goes to the implementation science aspect of it. So I have tried to group this into different aspects for us all to be able to look at it. And for qualitative, we have simple strategies like focus group discussions, so in-depth interviews with selected key people, stakeholder consultations. These are all means by which you can obtain feedback from the community to be able to say, okay, what we are doing the right thing, we are going in the right direction, and we are making the right impact. quantitatively, you can also go in for observational strategies, surveys, cross-sectional studies, exit interviews, cohort studies, randomized control trials. These are also other means of quantitatively evaluating your social innovation. And when it comes to the community participatory process itself, we have community scorecards, or you can have a suggestion box where people can actually put in suggestions about what they feel about the social innovation or what recommendations they have to help you improve your social innovation. You can have co-creation groups, which usually include having stakeholders from the community also give feedback into the project to help design it better. Crowdsourcing, open forums these are all very, very easily manageable means of conducting monitoring and evaluation. And I'm sure most of you have your fair experience using them in your day-to-day management and implementation of social innovation. So I looked at one of the basic activities that we are doing under the Pioneer Project, which is the use of co-creation as a means of both designing our project and also evaluating what we are doing. And going by the implementation of the co-creation activities, this is what our M&E framework looks like. Basically, it evaluates our co-creation meetings, the meetings itself. And that means right from the onset of a meeting, we have to decide what we hope to achieve from that meeting, who is going to facilitate the meeting, what materials we are going to need for that meeting, how many times we hope to have those meetings, who are the members who are going to constitute the committee that would actually go through the co-creation process, and how we hope to report our outcome from the meeting. And these tools or this outline actually help keep us in check when we are implementing our various co-creation group activities. And this is just an example for you to have a feel of it. So after all this, as I said, there are so many open resource materials out there that are easy to use and easily adaptable for anyone to be able to implement. However, for those of us who would need a little more detail and a little more hands-on approach and experience before we actually apply them, I would recommend that you visit the website link that I have posted there for a video on tutorials on the M&E framework by CHI, which goes a little more in-depth and also gives you much more explanations on the various pillars that I highlighted earlier on in the presentation. I think to make our session more realistic for those of you who are wondering, have we actually adapted some of those strategies? Yes, we have. And we have some panelists with us who are going to go through what is being done in CHI Nigeria and CHI China and how we have applied M&E to this aspect of the project. I'll hand over to Uche now, and we'll see you back in the panel discussion.
Yeah, thanks a lot, Gifty. It's been it's been very, very interesting. I believe that our audience would be by now, they would be pumped to take that first step to understanding what to take the first step towards M&E. No, I think one thing to note is that it's not, M&E is not, like she has rightly explained, it's not something that you have to think a lot about. It's basically what we do on a daily basis. For example, the strategies that the Gifted talked about in her presentation, these are things that we do regularly. These are things that we apply in our own line of work. So the question, all you have to think about is how you can implement that in order to assess whether you're meeting your health outcomes. And that is what monitoring and evaluation is about. And the good thing about it is that sometimes you don't have to limit yourself to one. There might be cases where you might have to use like 1, 2, 3 different strategies, depending on how complex your innovation is. So in order to sort of see how far we've come to understand what M&E is about, we're going to look at 2 case studies. One being Okana West community-based health insurance scheme in Nigeria. Now, it founded in 2014. It is focused on eliminating out-of-pocket expenses for members of the community. In other words, it pools the resources and reduces the cost of health healthcare for each individual member of that community. So that's one. And the second is the Pioneer Project being done in Shanghai, China, which we will also have a technical person in our panel, as one of our panelists, who would actually explain a bit further what they do there. So for now, I will have an introductory video followed by a panel session. Our panelists are Mr. Anibog Kingsley from Shanghai, Nigeria, and Ms. Tong Wan from Shanghai, China. So sit back and relax for the next 12 minutes. Would actually play videos for the introductory video and the panel discussion. Thank you.
So
Hi, there's no audio, Isha.
Is the number of the percentage of safe. Hi everyone, my name is Patrick. I'm the focal person for Ghana Wish 2 Community Based Out Initiative. One of the tools that we use for our M&E is the number of the percentage of service uptake at the primary health center for Ghana ECOM ED. Because we know that primary health centers in Nigeria is characterized by low and poor service uptake as a result of so many factors. So this is one of the M&E tools that we use. Another one is the number of pregnant women visiting the health center for antenatal services and the number of delivery in the primary health center and the number of postnatal services obtained by the delivered women, and also the number of children under 5 that are being immunized in the primary health center as a result of this design program. So we combine all these factors and factor them into our M&E and use it to know how far CDH have been able to achieve its goals and objectives. And another M&E tool that we use is the percentage of community involvement in healthcare delivery, which ensures accountability, ensures improved health service delivery by the community health workers. And another one is also the quarterly training and the percentage of number of training that we organize for the community health workers to improve their service delivery. So all this comes together to follow. Thank you.
So you're welcome to our panel session. We have with us Dr. Kingsley from Shanghai, Nigeria, also Dr. Uche, myself, and Dr. Ms. Tong from Shanghai, China, for us to talk about M&E in their respective social innovative implementations. I think I already worked with Dr. Tong, and she's going to tell us a little more about the Pioneer Project during her interaction. And Dr. Uche, take it up from here.
All right, thank you very much, Gifty. So let's start with Dr. Tong. Could you please just tell us a bit about the Pioneer Project that you're doing over there, so that we'll be able to understand how M&E falls into it and how it's important in your work. Thank you.
Okay, sure. Thank you, Dr. Uchi. Hi, everyone. My name is Tong Wang. I'm the research coordinator of the Pioneer Project. And to be more specific, our Pioneer Project is going to promote the chlamydia and gonorrhea testing among MSM in China to use the pay-forward mechanisms. And I think the MIE is quite important during my work for the Pioneer project because, like, first of all, MIE results in better transparency and accountability because, you know, Pioneer is quite a large project and like there is like many different stakeholders. So through the MIE, information could be freely circulated and available to different stakeholders, and that could give them more input on the projects. And the second is that actually MIE helped me to ensure that resources are used efficiently because like the Pioneer project needs like many different kinds of resources. So like resources could be easily be wasted in one area that isn't the source of the issue. So monitoring and evaluation actually helps me to prevent that waste. And the last is that actually the MNE helped me to catch problems earlier because, you know, a project that have different stages. So like through the MNE, me and other colleagues could ensure that to avoid like some problems or issues happened before the whole project begins. So I think that's all.
All right. Thank you very much for the brief description, explanation of what you're doing and you know how it's important, how M&E actually ties into your work. Okay, so now onto the topic of M&E. Could you just explain a bit about the particular M&E strategies that you've used so far, you know, and how you've applied them thus far? Thank you.
Yes, sure. Thank you, Dr. Ruchi. I can take an example to explain. Like, for example, I have been organized the cooperation group meetings before. To be like easy understanding, the cooperation is like an innovative version community advisory board, and through the meetings we usually discuss some question related to the Pioneer projects to the members, and the members could give feedbacks, comments, or advice for our research project questions. And I used one strategy is like after each meeting, I will send follow-up surveys to each participants. And I already organized 6 cooperation group meetings. And after each meetings, the members will like fill out the follow-up surveys to say like, hey, I want here to like have some improvements, or like they may feel uncomfortable or unsatisfied. So for some point of conversations. So through the follow-up survey, I improved each meeting step by step. And finally, we got a really high feedback and comments for our cooperation activities. So I actually think the follow-up survey is quite a feasible and effective MIE strategy for like organizing the meetings or others activities. Thank you.
Thank you very much, Dr. Song, for your time. Thank you very much for the elaborate explanation. I think at this point, if I'll hand it over to you to take it over from here. Thank you.
Oh, thank you very much. I think we'll just get some time with Dr. Kingsley as well. Although our time is limited, I'm hoping to pick your brain a little bit about the Organic Community project that is currently ongoing. We have heard a little bit about the M&E structures and some of the indicators that is being looked at when it comes to monitoring the intervention in Nigeria there. And my question is simply, what factors did you consider when you were developing this M&E framework that you're currently using?
The major consideration was how to keep a tab on service uptake. Particularly total number of children immunized, total number of children under 5 years who utilize the service, antenatal, those who enroll for antenatal care, and total number of deliveries, as well as total number of enrollment of adults. So it was important to use this criteria to be able to know if we actually progress in terms of meeting the set objectives, or or if we're experiencing, if we're not achieving anything at all. And the figures show that actually there was some progression over time as awareness improved, as we had more partners joining us, help us pay the premium, and help people enroll.
That is quite interesting. So just a little follow-up. I think it means that you have seen huge improvements in the enrollment and then service uptake among the children and also for antenatal care. And my question is, how has having this M&E framework benefited the project?
Yes, how it has been of benefit to the project implementation. It has helped us know areas where we need to move on. For instance, are more people and people are the right people are aware about the existence of the program. And then in terms of the priority area, that also helped us to know the areas, channel more attention. Are we giving more attention to ANC, natal care, delivery, so it has been quite beneficial. So, it has also helped our partners to know what area, depending on their area of interest, know what area they can actually partner on.
Okay. Thank you very much, Dr. Kingsley, and thank you also, Dr. Tom, for joining us today. We'll not take much of your time, but we'll get back to our participants and see if we have any further follow-up questions, and visit your website to learn more about your project. Thank you so much for joining us today.
Thank you.
All right, thank you very much. At this point, we would like to say thank you very much to the focal person from Okana West, and also a very big thank you to our panelists, Mr. Kingsley and Ms. Tong. Thanks a lot for the time. And I believe that the audience, you've heard everything the panelists have had to say about M&E and how they've been able to implement and apply M&E to what they're doing. I think one of the things that actually caught my attention was when one of the panelists mentioned that it helps them catch mistakes or catch errors on time, because we are human. So there is no way you can know exactly every single thing or every single problem you're going to come across when you're implementing your project. So it's important to have a way of accessing some of those bottlenecks and try to see if you can find ways of improving on it. A typical example is what we're doing in the this training session. At the end of every training session, we send out surveys. We ask you, how do we improve on it? And it has helped us over the past couple of weeks to improve on what we've been doing. And basically, we have you guys to thank for it. So at this point, I would head over to, we have done all the learning. At this point, we're going to move over to the interactive session, sort of to access what we've learned so far. And then if you have questions, definitely, I'd like to think that we'll have questions, and then you can also ask them. So I'd like us to maybe head over to, I'm going to share my screen now. Okay, so so we have quite a few questions for us. So you can head over to www.menti.com. You can head over to www.menti.com. The code is going to come out in a bit. Okay, yeah, so the code is 43930326. So the first question there, when you get to, hi, Joe, it seems your hand is raised. Hello? Okay, so head over to, you can head over to the Mentimeter link and just put in the code 43930326 and put it in. So the first question we have is, having listened to the first two to the two case studies that were presented to the Pioneer Project and then Okana West, CBHI. So which two examples of M&E frameworks of strategies presented today have been applied in the two case studies that we discussed over the course of this lecture? So we have focus group discussion and co-creation. We have exit interviews and in-depth interviews. We have community scorecards and in-depth interviews. We have none of the above, and then we have onshore. So you can head out to www.menti.com, and then you can put in the code, the Mentimeter code there. And not to worry, the results are hidden, so you can just answer. And I believe everyone has about 2 answers. You can provide up to 2 answers if you want. So we have 2 persons having answered so far. Okay, so we have 4%. I think maybe if we can get to about if you're having problems heading over to Mentimeter, you can still drop your response on the chat box. I think that's also an option. You can always yeah, you can hear what if you put it in the chat box, definitely would see it. So we have about 8 responses. Gifty, what do you think? We'll get to 20 and we'll show the results.
Yes, let's just give them a little time to be able to log on, and then we would be able to share our results.
All right, that's okay.
Oh, okay. Just go to.
Okay, someone is saying it will be more easy if we share the link. I think, I don't know if it's possible. I think you just have to put in, so I think the link, okay, sorry.
So just click on www.menti.com,
Yeah.
enter the code that is displayed on the slide, and you can just select your answers
Yeah.
after that.
Okay, so we have 11 respondents so far.
Okay.
So do we show?
Yes, let's go ahead,
I think
and
we
then
should show, so
those
we
who are
can
not
move
coming
on.
in can join the next one.
Yeah. Okay, so we have 43% of respondents saying focus group discussions, and co-creation. We have 26% saying, oh, well, people are still responding. So it seems a good number of our respondents, more than about half of the respondents are saying that focus group discussions and co-creations was actually used. And we also have those saying exit surveys and in-depth interviews. We also have those saying community scorecards and also in-depth interviews. So I think basically at this point, the M&E, case studies we'll present today, they actually made use of all 3 of them. I believe the Pioneer project that clearly mentioned that they use co-creation and exit surveys, and then for Okana West also, it made use of in-depth interviews to actually gauge how the beneficiaries, how they saw, how they viewed the program so far, and also places where there can be improvements. When they talked about community participation and involvement. So thank you very much, everyone. So I think let's move over to the second question because of time. So at this point, go wild. You can say anything you want to say. So it's basically that from the panel discussion that we've all listened to, what social determinants were considered in the CHI Nigeria M&E design. So for the Okana West Community Health Development Initiative, community-based health initiative, what do you think were some of the social determinants that probably are considered when they were deciding on, the M&EA approaches that to make use of. So it's still the same Mentimeter link. You just have to click on next, and then you'll be prompted to provide a response. I think you can provide up to about 1 or 2 responses. And alternatively, we also have the chat box. Yeah, thanks, Reina. Okay. Okay, we have 1 respondent. Okay. Okay, so we have 2 persons responding so far. I think, okay, 3 persons. So let me just show it up so that we can see what the answers are so far, while other answers are coming in. Okay, so we have health access and okay, yeah. So we have community, social and community, we have economic health systems, we have resource availability, we have participatory action, we have gender. Well, that's interesting. I think that's also very important, especially considering the fact that a lot of the programs that Okana West also does, is targeted at, antenatal care, because they also have they also ensure that some of the costs of antenatal care and childbirth are also taken up by the program. So we have access to healthcare being one of the things that almost everyone is actually talking about. We also have education. Yeah, it's also I think that's also important, considering the fact that it makes it easier to be able to explain certain concepts to the population. What do you think, Gifty?
Yeah, I actually like the fact that it's at the center of all this, because I think one of the things that Kingsley also mentioned is the need for routine training, even for the healthcare workers. And that shows how education actually played a very vital role in their implementation.
Yeah, I think that's great. Yeah, thanks a lot to our participants. Wow, these are some really nice things here that we have. Okay, so for want of time, I think we might need to go over to the next one. The third question. Let me share my slide so we can get to the third question. Oh, sorry.
So whilst Uche is sharing his slides, for those who are now joining us, we are currently on the questions aspect, and join us on Mentimeter. The code is displayed on the slide. You can just put in your answers and your responses to some of the questions we are discussing, and also share your opinion via the chat box for us to discuss. Thank you.
Yeah, thanks a lot, Gifty. So for this, use this code from when you get to Mentimeter, you go back to www.menti.com and then use this code. Let me copy this link and paste for the new one. So this is for the question number 3. And this is, are there any aspects of the current M&E structure that you think can be improved upon? So having listened to our introductory video, having listened to the panel discussion, let's say, for example, we talked about the fact that M&E, student innovation, moving it from one context to another. Let's say, for example, you want to apply it in your own context. Do you think that there's some things that should be improved on, some things that should be considered that weren't considered in the initial design? So let's hear your thoughts about this. Okay, how to include men in ANC. Thank you very much for the response. Okay, so we have 3 responses so far.
So, Uche, I'm actually thinking about this comment on how to include men in ANC. And
Okay.
I think it's something that we all have to consider when we are designing gender-specific interventions, that even though they are gender-specific, sometimes you may need to involve the other gender to help optimize some of these interventions. And let me say for Nigeria, for West Africa, or let's say for Africa, where we have a very gender norms play a very key role, even in our health services uptake. Definitely getting the men to add their voice to helping scale up antenatal care will actually go a long way to help advance or improve the impact of the project.
Yes, I think what you just said now reminds me of that was actually a survey study conducted by I think it was I think UNICEF or UNAIDS, I can't remember very well, but it was done in North Central Nigeria, and it was that was focused on health uptake regarding to, I think it had to do with something about nutrition for children. For children. Basically it actually tried to explore how parents were able, how they were seeking healthcare. And one of the things that the researchers noticed was that education played a major role, because they were comparing like 2 towns. So education played a major role. And then, the fact employability, the women that were more employed had a higher tendency, to seek out healthcare. So that also puts into perspective things like, where employment actually falls into this. And then there was also one of the things that I mentioned, that those that certain communities, men lending their voice or actually supporting the women actually improve the chances that those women would actually seek the healthcare, because men were regarded as those that, okay, what they say in the house, goes. So
Okay.
at this point, thank you very much for the responses. So we have clear tools, including men in N and ANC. We also have, with the implementation of implementation research approach. Thank you very much. So we also have all inclusiveness of community for accessing one health services. That's very important. We have our framework. We have setting up relevant indicators. And this one is something that you have to do, early on at the point, early on in your work. And then, thank you so much for your responses. And then we have finally, sorry. So do we have finally a Q&A? So you can ask any question that you want. But I think it will be best, I give it might be best for you to, finish the concluding slide, and then we can now go back to this.
I agree.
Okay, so I am going to post the concluding slide. Can you see the screen?
Yes, please.
Okay.
So far, thank you all for joining us, and thank you for sharing your ideas with us. We'll be sure to share them with our panelists also, and we are hoping maybe they can actually adopt some of these ideas and suggestions to help improve their implementation as well. To wrap up what we have learned for today, and I think it's been one of the most interesting sessions I've had to deal with in M&E. One of the driving message that we have for ourselves or for this study session is that M&E in social innovation is fluid. It means that you may need different tools, you may need different strategies at different stages or for different aspects of your social innovation, and you should be well ready and willing to adapt your systems to meet that need. You may need to adapt multiple strategies for actually evaluating your M&E instead of just trying to go with a strict standardized standardized guidelines when it comes to monitoring and evaluation. Another important thing to notice is the fact that, let me share the slide. Another important thing to know is that M&E is an ongoing process and should be undertaken throughout the implementation process. You don't just say, okay, let me finish implementing and evaluate at the end of the project, or let me evaluate from the beginning and then the rest, just forget about it because it looked good at the beginning. Trust me, sometimes it may look good from the start, but along the way, you may end up deviating if you don't have systems in place to keep you on track. And then the final aspect or the final message I want to say is that your M&E framework can be tailored. You can tailor validated open access M&E frameworks to suit your social innovation. So if you have a new project idea, if you have a new social innovation and you are not sure how to go about evaluating it, feel free to assess what open access resources are there and then tailor them to meet the needs of your monitoring and evaluation. Thank you very much to Uche, and also thank you to Dr. Tucker for mentorship on this. And thank you all for joining us as well. If you have any questions about what we have discussed, you don't understand something, please go ahead and put it in the chat box and let's see how best we can help explain it. Thank you.
Fantastic. Thanks so much, Gifty and Uche. That was really a tour de force. Really nice job and great questions. So just two brief announcements. First of all, next week, we will be meeting at the same time slot, and Dr. Rainer Tan and Dr. Ogachukwu will be discussing crowdfunding, which is a great topic, public engagement in crowdfunding. So please do join us then. And one other point of clarification, I know many of you had asked about a certificate of attendance, and basically how it will work next week. We'll have a final survey that we request everyone complete. And as part of that, if you've attended at least 5 out of the 7 sessions and complete the final survey, then we'll give you a certificate of attendance. And if you've been away and haven't been able to view 5, you can certainly, it's fine to go onto the website, and there are recorded versions of each of the training sessions. So, and including this one, I know many of you were unable to join at the hour. So if you want to go back and view the first 20 minutes or so, the full recording will be available after the presentation. So anything else? Any other announcements?
If you have any questions at any time, feel free to reach out to say hi.